This week we will continue covering different types of hospital statistics. The first type that we'll be looking at for this module is hospital death or mortality rates, and you will see those terms death and mortality used interchangeably when you're talking about these different rates. So you might be asked to calculate a death rate or a mortality rate, and just know that that's asking you for the same thing. Those terms can be switched out. This topic is covered in your textbook on pages 556 to 559, so please use that as a reference and a resource. Okay, several rules or things that you need to be aware of that apply when you're talking about hospital death rates. First of all, death rates are calculated based on the number of patients that were discharged from the facility, whether they were discharged alive or discharged due to being deceased. Remember that deaths are considered discharges because they are the end of a patient's hospitalization. Something that is a bit different for these rates than those that we've looked at previously is that newborns are not automatically calculated separately. Remember that one of our rules for previous calculations has been that adults and children are calculated separately from newborns. That is not the case for death rates, so just keep that in mind. Another rule is that babies who are stillborn are not included in these rates. So if you're given a set of information or statistics from a facility and asked to calculate death rates, just know that if information is included about babies who were stillborn, and we'll talk more about this later when we talk about fetal death rates, those babies that were stillborn would not be included in the rates. So you would want to exclude those numbers. Since we're talking about rates, the time period is important because remember that rates refer to how frequently something happens. So you'll want to be sure that when you're given information that you're looking for what time frame are you being asked to calculate things for, and then is your numerator in the same time format as your denominator. In other words, if you're given information about deaths during a day or a week, a month, a quarter, you've got to have your numerator and your denominator in the same time frame. So you may have to do some multiplying or some other math to get those to be the same. Another thing to be familiar with when it comes to death rates is that hospital death rates are always going to be proportions. And these are things that hopefully can help you to not just look at the formula and see a bunch of different random numbers, but to understand why the formula is the way it is, and to be able to kind of think your way through the rates and why it's the way it is. So on a proportion, the numerator is always going to be included in the denominator. The next rule to be aware of is that hospital death rates look at how many times something happened compared to how many times it could have happened. So for whatever rate you're calculating, you're going to look at your numerator is going to be how many times the event did occur, and your denominator is going to be a number that represents how many times it could have happened or occurred. Okay, this is a rate, and it's an inpatient rate because we're told that we're doing hospital death rates. So we're going to use our rule of multiplying by 100. That's the reason that's in the formula. Will be in all the formulas for this tutorial, is because we're doing inpatient rates, so don't forget to multiply by 100. Okay, there are 5 different types of hospital death rates that we're going to learn to calculate. The gross death rate, the net death rate, newborn death rate, fetal death rate, and the maternal death rate. So we'll be going over definitions and rules for each of these, as well as formulas. Okay, first, the gross death rate. This is a basic indicator of mortality for a facility. Um, in other words, how many discharges from that hospital ended in death. The formula for calculating gross death rates is the total number of inpatient deaths, including newborns, because remember we've already said that those are not automatically excluded, for a given period, divided by all of the discharges, the total number of discharges, including the deaths. And that's that rule of, since this is a proportion, the numerator is included in the denominator. So we're going to keep all of the deaths in that number that we're putting on the bottom for the same period. So total number of inpatient deaths, including newborns, for a given period, divided by the total number of discharges, including the deaths, for the same time period, and then multiply by 100 since we're calculating an inpatient rate. One way to think about why would you use or be asked to calculate a gross death rate. If a hospital wants to know how frequently do deaths occur in the hospital, this is when they could calculate this, and you could answer it by saying, well, for the month of, or for the week of, or during this past year, whatever the time period is, we had 300 patients who were discharged, and out of those, 25 died. So if you were setting that up into the gross death rate formula, you would say 25 would be your numerator, because that would be the total number of deaths, divided by 300, the total number of patients discharged, including the deaths, times 100. And both the numerator and the denominator would be referring to the same time period of the month. So this calculation isn't really that difficult. You just have to know which information to include, which means be sure you include newborns and be sure that you include deaths in your denominator. Okay, next type of death rate we're going to look at is the net death rate. Now, this is also a proportion, so again, you're going to include that numerator in your denominator. The difference in the net death rate and the gross death rate is that the net rate is adjusted. It does not include patients who die within 48 hours of admission to the hospital. And the reason for this is at one time it was believed that 48 hours was not enough time for a hospital or a facility to truly make a difference or change the condition of the patient significantly enough within that 48 hours. And so it was a way of not holding those deaths against the hospital. Now, there are some people who say that this rate is no longer that meaningful due to all of the advances in technology and things that do allow faster and better interventions to save the lives of patients. This rate is looked at, though, because lower death rates may indicate better care. Again, there's debates on either side as far as whether or not this death rate truly is meaningful and indicates better care. Now you see that I have a little net there on your screen, and that's because this rate is calculated just like the gross death rate, except you take the patients who died within 48 hours of admission out. And so one way to remember that is you take your net and you scoop out a certain population, which in this case that population is patients who have died within 48 hours of admission. So let's look at the formula. You're going to take the total number of inpatient deaths, including newborns, minus deaths that occurred less than 48 hours from admission for a given time period. So what you're scooping out with the net is those patients who died less than 48 hours from admission, divided by the total number of discharges, including all deaths, again, minus deaths that occurred less than 48 hours from admission for the same time period, and then multiply by 100. So again, same formula as gross death rate, except use your net to scoop out that certain population of patients. Hopefully that helps you to remember that one a little bit better. Okay, the third type of death rate that we're going to be looking at is the newborn death rate. Now, we've said it's not automatically calculated separately, but if you're asked to focus specifically on newborns, then certainly you can calculate it that way. And sometimes a facility might want to know that for some specific reason. This would include only infants who were born alive in the hospital. If you think back a few modules when we covered the definition of newborn, remember that to be considered a newborn, the patient must be born in the hospital, not on the way or at home and then brought to the hospital. And they must be born alive, meaning that stillborn infants are not included in any of these death rates. To determine the number of newborn or the newborn death rate, your formula is the total number of newborn deaths for a given period divided by the total number of newborn discharges, again including your deaths in that denominator, for the same period times 100. Okay, our next rate is the fetal death rate. Now there's a few definitions that we need to be familiar with when calculating this death rate. Sometimes we commonly hear the term stillborn. Stillborn, the definition and the actual medical term is fetal death, and that's a death that occurs prior to the fetus's complete expulsion or extraction from the mother in a hospital facility, regardless of the length of pregnancy. And fetal death is determined when the fetus shows no signs of life. In other words, no heartbeat, no pulse in the umbilical cord, and no voluntary movement. Stillborns are not considered admissions or discharges. Okay, when you're calculating fetal death, there are some different categories that these deaths are classified into based on the length of gestation, or how long the mother had been pregnant, along with the weight of the fetus, and you will need to memorize these guidelines. A fetal death is considered early if the gestation period is less than 20 weeks or the fetus weighs 500 grams or less. An intermediate fetal death is when the mother is at least 20 weeks pregnant, but less than 28 weeks, or the fetus weighs between 501 and 1,000 grams. Late fetal deaths occur after 28 weeks, so 28 up to 40 weeks, or when the fetus weighs more than 1,000 grams. And as I said, you will need to be very familiar with these so that you'll know how to classify these fetal deaths. Okay, so the death rate or the formula for fetal deaths is your total number of intermediate and late fetal deaths for a given period. So if you were given information in a problem, you would have to take out the early fetal deaths, because your numerator for this formula includes intermediate and late fetal deaths for a given period, divided by the total number of live births plus the total number of intermediate and late fetal deaths for the same period times 100. Now let's kind of make sense out of this formula. Remember that we said that rates look at how many times something happened compared to how many times it could have happened. So how many, if you're looking at your numerator, how many intermediate and late fetal deaths occurred during a certain time frame, compared to your denominator, how many times could that have happened? How many live births were there? And then included in that live births, we have to include the number of intermediate and late fetal deaths to have a total number of how many times those fetal deaths could have actually occurred. Okay, last rate for this tutorial is the maternal death rate. Maternal death is defined as the death of any woman from any cause that's related to or aggravated by pregnancy or its management, regardless of the duration or site of the pregnancy. And site meaning whether it was an ectopic or a uterine pregnancy. Accidental or incidental deaths would not be included. So if a mother who was pregnant was involved in a motor vehicle accident, that would not be considered, that would not be calculated in with the maternal death rate. The maternal death rate is sometimes used as an indicator of how available is prenatal care in a certain community or at a certain facility. The hospital may also use this rate to identify risk factors or conditions that can lead to or prevent maternal deaths. Okay, just like with the fetal death rate, maternal deaths are broken down into two different categories, either direct or indirect. So a maternal death that is direct would be one that results from obstetric or OB complications of the pregnancy state, labor, or puerperium, which is the period including the 6 weeks after delivery. Examples of direct maternal deaths would be sepsis, an obstructed labor, or an ectopic pregnancy. An indirect maternal death results from a previously existing disease or a disease that develops during pregnancy, labor, or the period immediately following delivery that was not totally due to OB causes or obstetric causes, but the pregnancy was partially responsible. And some examples of that would be anemia, diabetes, or HIV. The formula for calculating maternal death rates is the total number of direct maternal deaths for a given period. So you need to be able to pick out those that are direct maternal deaths if you're given a set of information, divided by the total number of maternal discharges, including deaths for the same period, divided by 100. Okay, that was all of those 5 rates. So hopefully you have made notes on your formula sheet as you have gone through this tutorial. I encourage you to look at table 10.15, which is found on page 559 in your book. It gives you a summary of how to calculate each of these different statistics or different rates, and it tells you what your numerator should be and what your denominator should be. And then if you will work through the Check Your Understanding 10.7 on page 560, you can work through numbers 1 through 6 and then check your answers in the back of the book to see if you're, give you some practice and see if you're calculating these rates correctly. Please let me know if you have any questions or need assistance. Thank you.